Hi, my name is Dr. Sagar. I'm a chartered psychologist. In this video, I talk about the benefits of physical activity to our health and well-being. I will talk briefly about the benefits to our physical health and will then focus on the benefits to our psychological or mental health and well-being. But first, what is physical activity? It is any activity that we undertake that uses our muscles to move our bodies and thereby to burn energy or calories that are stored in our bodies. Physical activity includes various physical movements such as these activities that you can see in the pictures: dancing, walking, playing sport, cleaning the house, going up and down stairs, gardening, doing home DIY, as well as exercising in the gym, at home, or in the park. Researchers have examined the benefits of physical activity to human physical health. And in addition to weight loss, they have also shown that regular physical activity can reduce our risk of developing many physical diseases, such as hyperlipidemia, which is a high cholesterol level, cardiovascular disease, such as heart disease and high blood pressure, as well as stroke, type 2 diabetes, and certain cancers. Physical activity can also help with symptoms of osteoporosis and sleep disorders, and can enhance the functioning of the immune system and our fitness and mobility. There's also plenty of research evidence that shows that physical activity has also numerous benefits to our psychological health and well-being. This is particularly relevant to us nowadays when we see a worrying rise in mental illness among children, youth, and adults in Western societies. Some research reported a genetic link to the development of mental illness, but much of the research found that stress and anxiety played a key role in mental illness, including phobias, addictions, and depression. Nowadays, stress is present in different aspects of our lives. Many people are working long hours and feeling pressured to achieve success both at work and in their personal lives, and many have health and financial worries. Furthermore, many people experience continuous internal struggles, questioning themselves. Am I clever enough, good enough, attractive enough? Have I achieved enough? And so on. Considering the prevalence of mental illness, it is very important now, more than ever, for people of all ages to engage in physical activity daily. Before we look at the benefits of physical activity to mental health, let's find out what mental health and well-being means. Psychologists define it as a psychological state in which our emotions and behaviors are balanced and we are not feeling anxious and are able to create and maintain positive relationships with others and cope effectively with our everyday life demands. Regular physical activity can provide mental health benefits both to clinical and non-clinical populations. So it can help those who are experiencing mental illness and those who are not. We know from research evidence that regular physical activity can reduce stress levels, enhance positive emotions and mood, enhance cognitive functioning in children and in adults, and enhance low perceptions of self and identity and body image, which have been associated with negative psychological struggles. So regular physical activity can enhance these people's body satisfaction, perceptions of self-control, sense of empowerment, and coping ability. Regular physical activity can also provide structure, meaning, and sense of purpose in day-to-day life, and a sense of optimism and hope. It can also decrease anger and aggression. Physical activity stimulates the rise of the neurotransmitter serotonin and GABA levels, which have a calming and relaxing effect in the brain and help with impulse control and pain relief and put us in a positive mood. Regular physical activity also benefits the mental health and well-being of children and youth. Research has found that it helped them to have fewer symptoms of stress, anxiety, and depression, and enhanced their self-confidence, social skills and relationships, and cognitive ability. So they were able to learn better. Physical activity can also help those suffering from mild to moderate levels of the psychological disorders listed here. That is, sufferers who engaged in regular physical activity reported fewer symptoms of these disorders. Nowadays, the NHS in the UK, psychologists, psychiatrists, GPs and other healthcare practitioners prescribe physical activity as part of treatment for mental health conditions and promote regular physical activity for good mental and physical health. The GP exercise referral scheme has been available in the UK in the last 20 years and has proved to be valuable. Under this scheme, GPs refer patients with different physical and psychological conditions to professional exercise centers that deliver exercise programs that are tailored to suit their needs with a view to improve their fitness and health and to help them become physically active and lead a healthier lifestyle. The American College of Sport Medicine recommends 60 minutes of moderate intensity exercise daily for good mental and physical health. It is advisable, however, to consult a medical practitioner before engaging in any exercise program to find out which type of exercise you should embark upon and at what intensity and frequency. As we can see, research has provided overwhelming support for the benefits of physical activity to our physical and psychological health and well-being. It is beneficial to people of all ages and to our society as a whole. So let's begin to engage in some physical activity today to protect our health and well-being. Thank you for watching this video. I hope that you found it interesting. Bye for now.